So my name is Chantel Jimenez. I am the Urban Refuge Coordinator for the U.S. Fish and Wildlife Service stationed in San Diego, working on the San Diego National Wildlife Refuges. We have partnered with Outdoor Outreach, Outdoor Foundation, Thrive Outside San Diego, the San Diego Foundation, and the Nonprofit Institute to put this webinar series on for you. The purpose of the Leaders for Outdoor Equity series is to give land managers and recreational leaders from public agencies, nonprofits, and the outdoor industry an opportunity to learn about the vital role of outdoor access and public lands in our health, well-being, and quality of life. It is also meant to deepen our understanding and leadership skills around issues of race and equity as they relate to the outdoors. It is with this in mind that I want to take a moment to acknowledge that our communities in San Diego sit on the ancestral lands of the Kumeyaay Nation. We extend our respect and gratitude to the Kumeyaay peoples who have lived here since time immemorial. During our previous webinars, we talked about climate change, environmental justice, and the outdoors. By raising awareness about how these issues play out in our public lands, as well as the efforts to address them, we can build on efforts already underway to promote inclusive and equitable access and use of our public lands. I'm going to give just some quick highlights from the last one that we did. Carolyn Brower talked about how national efforts to protect 30% of our lands by 2030, the 30 by 30 movement that some of you might have heard of. She noted that the Biden administration wants to hear from people outside of Washington what is needed from 30 by 30 from indigenous leaders, what hunting and harvesting rights are needed, what is needed by ways of accessibility rights, as well as language needs and signage. Madeline Drake noted that California is spearheading a statewide effort to advance 30 by 30, and the state wants to foster an open source movement of Californians working with the state to protect biodiversity and address the climate crisis. Steve Barker and Danica had a great, back and forth roundtable discussion. They talked about how racism and inequalities in the outdoor access are reflected in the traditional customer base of the outdoor industry. They shared how many outdoor brands are realizing that their survival hinges on the products appealing to a more diverse customer base. They also noted how some of the industry is shifting to support organizations that are working to promote more inclusive and equitable outdoor access. A growing group of smaller outfitters are getting more involved in advocacy to get more children and families engaged in outdoor recreation. Dr. Walt Lara Sr. and Victor Balizik shared how state and nonprofit national park officials have historically prevented the Yurok and other native communities from accessing their traditional territories for ceremony and resource use. Dr. Lara noted that every time the park system leadership changes, we get changed. He is hopeful that current state park leadership creates lasting policies and procedures that ensure native use of park lands for ceremonies and resource access. Lastly, Martina Morgan and Nina Hafner shared how the Kumeyaay people have worked really hard to get the state park officials to stop pay for prey policies and ensure native communities access to the ancestral territories. It has been a common practice for state parks to charge native communities park entrance fees to access their traditional resources and places for holding sacred ceremonies. So it was a really great session, and it was eye-opening for a lot of the people that were on that webinar. So again, I would say check it out. It was really cool. As leaders in the environmental and outdoor sectors, we need to rethink the outdoors, what the outdoors represents to all citizens of this country, and who are the experts in stewarding these natural resources. How can we all together remove barriers and create more inclusive and equitable access to the outdoor? Today's webinar will pick up on the theme that was touched upon the last time, nature as a place of healing and medicine. As always, we encourage you to sit with and reflect upon the insights and perspectives offered by our different speakers today, because all of you are going to be part of what happened next. And now I would like to introduce or turn over this session to Les Duncan, Senior Program Director of Outdoor Outreach. Les will be facilitating the conversation among our speakers today. Take it, Les.
Thank you so much, Chantel, and good morning, everyone. Thank you, Chantel, for really setting the tone for today and bringing us up to speed on kind of the arc of this webinar series that is the Leaders for Outdoor Equity Training Series. I'd like to start today's session by creating a word cloud. And so I'll ask Michelle at this time if you could go ahead and share the link to that word cloud. And today what we're asking of each of you is to share one word that comes to mind when you think about nature as medicine or nature as a healer. So if you would, please take about a minute to enter your word. Excellent. Seeing home, refreshing, healing, serenity. Breathe, alive, silence. That is vital as medicine. Rejuvenating, ahan. If someone could drop in the chat box what that means, that would be excellent. Ahan. I haven't heard that word before. Ancestors, resilience. Anthropomorphizing. Excellent. Traditional foods, culture, autonomy. I'll give maybe about 15 more seconds. If you haven't yet, please feel free to enter a word. Peace is really coming up. Excellent, excellent. We'll go ahead and pause the word cloud here, but if you would, thank you, or really thank you again for sharing sharing some of your words and kind of entering into that nature as a healing space with us today. So to talk a little bit about the format of today's session, I'd like to introduce you to our phenomenal group of speakers. I feel so honored and privileged to just be setting this table with you all. So first we'll hear from Dr. Stan Rodriguez, who is a local tribal elder from the Santa Isabel Kumeyaay, Santa Isabel band of Ipe Nation, who will provide a Kumeyaay perspective on nature as medicine. And I got to get kind of a quick glimpse of that recently. I think it was last month at the Tule Reed boat launch out on Mission Bay. And then we'll hear from three speakers who will talk about nature as a source of healing through the lens of natural resources and natural resource management, public health, healthcare, and community benefit. And respectively, you'll hear from Dr. Nasheen Razani from UCSF Benioff Children's Hospital. You'll hear from the California Natural Resources Agency Undersecretary Angela Barranco, and you'll hear from Ale Ricardez. And then finally, we'll bring all of our speakers back together for a panel discussion, bringing back also Alexis Morrow, who all of you are familiar with from our first webinar in this series. And Alexis Morrow comes to us from a very familiar organization, from Outdoor Outreach, where she's been both a participant, a program coordinator, and now a development coordinator, and just really has even gone beyond our organization to also train other organizations on trauma-informed programming in the outdoors. So very much looking forward to bringing together this robust group of illustrious speakers. Throughout today's program, I want you to really think about where you see yourself. So really bringing it back to the individual level in the work of healing in nature. Think about what you can do from your role to be more of a leader for outdoor equity and healing. We invite you to use this time and this space as an opportunity both for self-reflection as well as an opportunity to learn collectively and to examine the systems that we work within. So now, without further ado, I'd like to introduce our first speaker, Dr. Stan Rodriguez. Stan is the director of and instructor at Kumeyaay Community College, as well as a tribal singer. And due to the many speakers that we're hosting today, their in-depth bios will be provided in the chat box. And so without further ado, Dr. Stan Rodriguez, Stan, if you would, please take the floor.
Oka, ipenya tipe cham, menyuaya. Stamina chuhin, makupai witkonam. Bele helikoinya we huyu peinya kanapia. Mamlimara nyeb matan. Good morning, ladies and gentlemen. My name is Stan Rodriguez. I'm an Ipai Kumeyaay from the Santa Isabel Band of the Ipai Nation. And just wanted to say that I wish all of you, wherever you're at, you're having a good day and things come to you. I know some people we did a thing 5 fingers up, or some people had 2 fingers. And for some of you who have 2 fingers, I hope some of those other fingers will come up for you. And the Creator bless you. So I wanted to talk a little bit about the Native perspective, in particular the Kumeyaay perspective on this land, on the earth, and the healing, the medicine that comes from this. So our philosophy or our spirituality, I would say it diverges from Christianity in the sense that, what was it in Genesis? They talk about this land was given to people to dominate and control, the dominion of all of these things. For our people, it's completely different, that this land, we are a part of it. We don't own it, but we're a part of this. When we leave, the land will be here, and we all are going to have to go. And the earth is, to us, it's our mother. And how do we treat our mother? Our mother brought us into the world. Our mother brought these gifts for us. Our mother took care of us, takes care of us. So we reciprocate, we take care of our mother too. And in our creation story, it talks about when the universe was created and this land was put here. This land is a place for us to heal, for us to grow. And this earth gives us things, plants, animals that we share with each other for foods. And we have a responsibility. And part of that responsibility is to give back. When we talk about the other plants that were given, some of those plants were medicine plants, plants to help heal us. But just because they're a medicine plant, there's a certain way to take care of it. There's a certain way to pick it. There's a certain way to use it. And not all medicine plants can be used at the same time. There are certain things that need to happen for this to take place. And I think many people forget the spirituality part of the connection that we have with everything here. And when we talk about these things, it all goes back to our learning in the creation story. And an example is when the Creator created all the animals and all the plants, all of these things, we all looked at each other as relatives, not as us separate from everything. So these trees, these animals, all of us, we are interdependent on each other. And the Creator taught us things like fire signs in order to create a mosaic pattern on the land. This helps more plants to grow. It helps certain plants to grow the way that we could utilize them. And we would do it in a way to control fire damage. So all these things were taught to us in many different ways. The animals, the different animals and the stories that each one tells. And when we talk about the land, what the land can teach us and how the land can be used as medicine. I'm going to give you an example. We have a story of a moo, which is the mountain sheep. And the mountain sheep, it lives in a place that is very desolate, very little food, very little water. And what the moo or the mountain sheep teaches us is how to overcome adversity, how to conduct ourselves. How many times have we all gone through adversity in our lives? So we learn from the different things. We learn from this animal. Another one. How many of you have ever, how many of you ever been on a farm? How many of you ever seen geese? Aren't they cuddly? Don't you just want to pick them up and hold them? No, because they're mean. They try to bite you. They try to snap at you. Well, in our creation story, it talks about the goose when the creator was going to leave this world and go back into the universe of the spiritual universe where he came from. And the goose was trying to tell everybody how to do the ceremony, bossing people around, bossing people around like this. Finally, all the animals told him, shut up, knock it off. So when somebody gets real bossy, they say, they're acting like a goose, because that teaches us when we start to get like that, or when we're doing that to other people, how, not to sound like a psychologist, but how does that make you feel? I mean, it takes away, from the happiness that you may have in your heart. So in other words, all these things are lessons for us on how to conduct ourselves, how to be respectful to others. How many times have you gotten sick just by stress, just by all these things? Many times we will say, what you need to do is take off your shoes and go walk through that field right now. Just have the earth take care of you. Have the earth heal you. Walk to that medicine. Ask that medicine. Just don't pick up a plant and say, well, I know this is used for a medicine and heal me, but ask that medicine to help you. Ask it to take care of you. So this is part of our philosophy. Again, when we look at these things, that how we conduct ourselves and how we take care of the earth. Because when we take care of somebody, and this is something, again, I want you to remember when we're talking about the land, when we're talking about the earth, when we're talking about all these things, it's relationships that we have. And for you, when you've taken care of somebody and they take care of you also, it's reciprocal. It creates a bond. It creates a relationship that you have. And when you take care of your mother, when your mother takes care of you and you take care of your mother takes care of you. It all goes back and forth. But what happens when you don't? What happens when you just take from your mother or from people or from the land, all these different things? Then you don't have that type of a healthy relationship. Then you have a relationship that is built more on sickness. How many of you ever had a cold? How many of you ever caught the bug? Well, we can either treat this land as holy, as sacred, that we are part of it, or we can keep taking. And then when we get the land sick, what's going to happen? They're going to get a fever. And what do fevers do? Kill off the infection. So I just wanted to share that. And this is our responsibility, because we have to choose what kind of relationship we're going to have with others. We can either have a toxic relationship, or we can have a relationship that's built on love and trust. That toxic relationship will breed toxicity. It'll come back. And I just wanted to share that. And we learned that in our creation story. Let me tell you one more thing before I shut my snoot and give this to somebody else. In our creation story, there was a part of it where this one young person was coming for knowledge, and this great snake was in front of him. The snake, the blood was gold, and the spit was silver, and the urine kept going into the ocean. And it was said, you do not mess around, play around with gold or silver, because it makes people sick. Well, anyway, this snake wanted to destroy everything in its path. So this young person broke the teeth of the snake, grabbed it by its tail, and flung it to the north. We say Katush, the place where the lights are, and it froze. And we said, as long as that snake stays frozen, we will be able to continue to grow. But if that snake ever unfreezes, it will wreak havoc upon humanity and the world. So what does that mean for today? Again, when we see climate change, global warming, what is happening? You know, we say that snake is starting to wake up. And what is the impact? It's not just impact on the Kumeyaay, it's going to be impact on all of us as human beings, as members of this planet, the landscape, everything. So when we talk about healing, part of the healing is we have to take care of this land. We have to be stewards of this land. It is important. It is incumbent upon all of us to do this. So I just wanted to share those few words. And I want to thank you for taking your time to listen to me. Yeah, Khan. Thank you.
Thank you so much, Stan. I can't tell you how much I appreciate that, and how Ahan that message was to me as well, learning that Ahan means good. So thank you so much for sharing. Next, we'll be introducing 3 speakers that will each present concurrently after each other. I'll introduce the first speaker, Dr. Nasheen Razani, and Michelle will drop her bio in the chat. But I'll just take this opportunity to, on a more personal level, introduce Dr. Nasheen. We connected, I believe, for the first time maybe 2 or 3 years ago, but even before that, I've read extensively about her incredible work around prescribing nature. She has done some incredible work, and if you haven't gotten the chance, definitely look up some of the research that she's done and compiled at UCSF, Benioff Children's Hospital. But not only is she a researcher and a practitioner as a pediatrician as well, she's also an advocate. And so we've also connected and crossed paths through our shared work through the Parks Now Coalition, advocating for more equitable access to outdoor spaces and to green spaces across this beautiful state of California, and her work precedes her even beyond. And so next, I'd like to turn the floor over to Dr. Nasheen Razani to offer our keynote presentation.
Thank you so much for the introduction, Les, and thank you everyone for inviting me to be here. It's truly an honor to present after Dr. Rodriguez. I was really moved by his words, and also just really I thought about the current climate crisis that we're in, and his story about the creation story and the snake. And, you know, this year, the American Academy of Pediatrics and also the American Academy of Child and Adolescent Psychiatrists declared that there's also a crisis in pediatric mental health. And so, you know, as this group, you very, very important group of people are working on developing our relationship with the natural world and natural resources, you are also doing the work of actually saving ourselves, and I think children who are often the most vulnerable members of society. I do also feel very humbled presenting after Dr. Rodriguez, because I walk many worlds, and what I'm about to present is quite reductive and about the medical establishment and Western scientific literature and how we understand nature and healing, which is not the only way to understand it. And I think I'm sharing my screen. Did I do it? Sadly, I showed my last slide first, but that's okay. So I'm going to first talk about evidence-based in terms of literature, which is not the only type of evidence. It's definitely not indigenous evidence-based, but there's been a lot of research published about nature and health. So I'm going to give a brief summary of what's happening in that area. I will talk about the ways in which access to nature is a social determinant of health. And then I will talk about the program that we have in Oakland, which integrates nature into patient care. I didn't mention that the talk is actually called The Medical Backyard, because we talk about the medical home, But because these crises in healthcare are so large, we really can't deal with pediatric health on our own. And so while I do prescribe nature, I actually think about what I do as building partnerships for healing, because doctors cannot do this on their own. So while this knowledge has been known forever, and actually in the field of psychology, there is even an eco-psychology journal, and this work has been known for a while. The first paper that really brought this line of evidence into the medical world was a study by a landscape architect in the 1980s. And what he did was look at a hospital ward where people who had surgery were either put in a room that had a view of a brick wall or a natural scene. And what he found was people who had had the same surgery, it was a gallbladder surgery, ended up staying in the hospital less and had were less negative towards the nurses and used less pain medicine when they had a view of nature. And that article started this idea of nature having a physiological restorative effect. Since that time, there has been like a literal explosion of papers. And this little, I don't know if you can see my arrow, but this little graph at the bottom right shows the number of publications in PubMed over time. And really, it's just like gone from several to thousands and systematic reviews coming out every day. And at this point, we really have a lot of evidence that exposure to nature is associated with benefits across the lifespan. And that includes a lot of convincing data in the prenatal period all the way through elderly period. And I'll go through some of this evidence. That was about individual health. There's also a lot written about nature in terms of family and community health, which you may have done in other webinars, which I won't go through today. And of course, those of us on this call or Zoom call are interested in the fact that nature can also instill a sense of environmental stewardship and a love of nature and a passage of cultural practices, which ultimately, hopefully, will lead to planetary health. So the evidence about nature and health really falls into three categories. And the first category, which is where most of the studies are these huge population-based studies that are cross-sectional. And then there are studies that are experimental, but there's actually not that many of them. And they often look at the immediate health impacts of taking more urban people and putting them in nature for 15 minutes or so. And then there are a few randomized trials and other trials with control groups, which I'm going to try to talk more about that level of evidence today. But in terms of the larger census-based studies, what we really learned is that those who live in greener neighborhoods have reduced mortality at every income level. And actually the impact of green exposure seems to be biggest at the lowest impact level, lowest income levels, which really has created this understanding that nature can actually help mitigate health inequities caused by income. In terms of some of the more experimental studies, some of the landmark work was done near Palo Alto. And this was a work by Dr. Bratman, who some of you may know. He's at University of Washington now. But he took healthy participants living in Palo Alto, it's not that urban, and he randomly assigned them to walking in either a natural environment or a more urban environment. And then he did brain scans and questionnaires after. And what he saw was that this phenomenon of rumination, which is associated with depression and anxiety, was improved significantly for those who walked through the natural environment. Another a landmark study in kids was a study that took children with ADHD, they happened to mostly be males, and took them through 20-minute walks in an urban park, through a downtown setting, and then through a residential area. And this was published by Dr. Kuo, who is really one of the main leaders of this science, and she's done a lot of very important work. And what they showed was that concentration, which was measured by counting backwards essentially, improved the most when kids walked through a park. And they actually were able to show that that effect was equivalent to methylphenidate use. And in my work, I definitely am not anti-medication for kids, but certainly if there's a lifestyle change we can make to decrease medication use, it's of great significance. Oops. And this study was really important because it used an outcome that people really care about, and which was easy to quantify. Here is another randomized trial, which is absolutely one of my favorite papers, and I hope is useful to you. And it's a randomized trial, but not looking at the individual, it's looking at a community. And so in this work, they looked at Philadelphia, where there were a whole bunch of empty lots across the city. And what they did was randomly assign those lots to either be greened, to just be cleaned through trash pickup, or to have no intervention. Then they went and they interviewed the residents of each community without telling them what the study was about. And they asked them questions about depression and other mental health outcomes. And what they found is after the intervention, only the people in the areas where the lots were greened showed a significant decrease in feeling depressed and feeling worthless, which was an amazing, piece of evidence that really people have the right to have environments which are not depressogenic or don't make them depressed, and that adding green space to a neighborhood is a way to improve mental health. So at this point, now that there have been many studies, there is work talking about like the mechanism of action. But I think I want to draw on what Dr. Rodriguez said, that, if nature is our mother and we are part of nature, and this is about building a relationship with nature, I think that we should not get too caught up on this, because it's kind of like, trying to prove the worth of a relationship with your mother. Like, we can parse it out, like how many days a week should you have dinner with her, for how many minutes, but in actuality, we can also just start doing policy and advocacy for the fact that it's good for us to be around nature. But in case anybody needs to know the exact mechanism, the one arrow that seems to have the highest evidence is the fact that nature relieves stress. And that's been shown through changes in cortisol and pulse rate and blood pressure, and a variety of studies, and which are quite robust. There's also quite a bit on nature and physical activity. I won't go through the details of these, but you guys can just have this. And there does seem to be an added benefit to exercising in green spaces above and beyond just the benefit of exercise itself. A lot of the work on health outcomes in the preterm, before birth and for maternal well-being seems to be related to air quality. And newborns that live in areas with lots of green spaces have higher birth weight and head circumference. And it's also thought that the improvements in actual lifespan have to do with decrease in air pollution. And so living in green space has many, as we've talked about, emotional and mental health benefits, but it's really actually about the right to access fresh air, and that air quality absolutely can be mitigated by the addition of green space into a neighborhood. One area that I'm very interested in is the role of nature in helping to build social connection. And there does seem to be something about hanging out with other people in natural settings, which tends to strengthen the bond between people. Some of this literature comes from the more wilderness adventure work, where, for example, there was a study of whitewater river rafting that showed that people who were in the same boat had higher oxytocin levels that mirrored one another than people in different boats. This photo is from an outing that I organized for my own community, which is an Iranian American community in the Bay Area. And I think that just being together outside really allowed us to learn, about the games and traditions of our elders, and really gave us time and space to connect and eat together in a way that we wouldn't in non-natural spaces. I do want to say that Dr. Nina Roberts' research in SF State has really showed that eating together outdoors is something that resonates across almost all cultures as a way of connecting with nature. And as you know, social integration has a dose-dependent protective effect on health. During the pandemic, I used to always show this slide just to remind people that it doesn't have to be a big thing like this. Even a single relationship is very powerful, especially in a child's life. And so to the extent that parks will allow mothers to have time to spend with their kids in a quality way, or fathers or any caregiver, nature can be a very important part of helping a child establish a protective relationship with an adult. And nature supports childhood development. These are photos from the nature outings that I do at my hospital, just showing the importance of allowing children time to play, to create forts, and that stuff is actually essential to executive function and the development of social skills. And finally, nature supports healthy attachments, and that includes attachment to space. And in the past, we had a developmental milestone which included attaching to the place where we lived. And the picture on the right is a butterfly sanctuary that my daughter made in our backyard. And I show this photo to show that for children, nature doesn't really have to be big, and it definitely doesn't have to be beautiful. It just needs to be a place of freedom where they can manipulate the pieces and create, and really feel attachment in a way that allows them to be involved in that space in a very hands-on way. And the picture on the left is from our nature outings and shows some of the attachments that people make across culture and across families when they're allowed to be outside together. Les, can you remind me how many minutes I have so I can decide?
Yeah, absolutely. Still an additional 5 to 10 more minutes.
Okay. So this study I would really like to highlight because it was done in Los Angeles and it just came out. And it shows that it was done by the Prevention Institute with UCLA. And it shows a real clear association between access to parks and also life expectancy. And it has some really good numbers that can be used for advocacy. I did a national study looking at the presence of parks and health outcomes in children. And first of all, it was rare to say that children didn't have access to a park at all. But living in poverty and also living in a rural area was associated with not having access to a park, which is really important to remember, that not children may have access, may live around nature in rural areas, but it's not always public land and it's not always a park. But we didn't see an association with mental health diagnoses. And I think I want to point out that one of the major researchers in this area says that green space is not a binary variable. That means it's not a yes or no, whether you have a park. It actually matters what that green space is like and what the elements in that park are like. And that UCLA study talked about how low or poor quality parks negatively affect visitation and use and create a barrier to access. So how the space looks is actually very important to how and whether it's used. So in my last few minutes, I do want to say that all of that information about the benefits of nature were brought to us like around 2010, and we were asked to create a park prescription program in Oakland. And this is a picture from one of our nature outings. We do now have an active park prescription program where we take people out into nature. But when we first got that invitation, the doctors actually pushed back because the same people that don't have access to nature are the same people that have so many health problems that need access to nature. And in Oakland, you can see that just like in LA, life expectancy is higher in the places that are in the hills that have the green space. And actually, if you take an airplane and you go above most cities in the world, there's like a green line, and it is where people have access to money and where they don't. And it also in Oakland and many other places is the same line that reflects exposure to toxicity. And this is a map of the EnviroScreen score, which happens to be almost the same map as exposure to green space. In Oakland, 5% of the tree cover is in the flatlands, which is also some of which was Superfund sites before. So, and this is a slide looking across all of the United States, which shows that access to green is also related to race, which independent of income. And in the United States, neighborhoods with Black and Latino residents are less likely to have green space regardless of income. So in thinking about our own program, we actually talked to public health providers to see what they thought was important in a program like this. And this is just a slide looking at all the different levels of change that are possible, and to say that a clinic-based intervention is really an intervention at the individual level, but that policy changes, such as will be discussed after me, to increase the number of parks and trees in neighborhoods is as welcome by physicians as park prescription programs. I won't go through this. So our park prescription program is really an effort to decrease the barriers to nature. We did that first by bringing nature into our clinic through these big installments that the park district put in our clinic for us. And we have a prescription pad, but really the most important thing is we integrated it into our electronic medical record. And then when people get the prescription, they come on these outings with us. And the values of our outings, SHINE stands for Stay Healthy in Nature Every Day, are inclusion, cultural humility, and developmentally appropriate programming. And these are, our program is family-based because we want families to create behaviors that they enjoy together so that they can keep doing it on their own. And we integrate pediatric residents. The top right is Morgan Green. I don't know if any of you know him because he's become very active in the nature and health world now. And he was a pediatric resident that helped me. We did a randomized trial, which I don't have time to tell you about now. And we really learned that taking care of kids is about partnership. And so we really feel like the park staff are part of the medical team. That's it. Thank you so much for letting me present. And I do have one ask of the group if I haven't talked too much, but I'm working with Les on a grant for the Office of the Surgeon General on how nature may be helpful for ACEs. And I would really, really appreciate any of you that take the time to fill out our survey. The findings will go on the Office of the Surgeon General website. At ACEs Aware, there is a little drawing for anyone that wants to enter it for a lottery for completing the survey. And there's two, one for healthcare affiliates and one for outdoor agencies. Thank you.
Excellent. Thank you. Thank you so much, Nasheen. And yes, definitely want to encourage everyone that's on this call, if you would, please take a moment to complete the survey. And maybe Nasheen, if you could drop this link also into the chat, or Michelle, as kind of quick access for the group as well. But thank you again for centering us in that discussion. Thank you for, as you mentioned also, the science is only kind of catching up to or adding evidence to what we already know through indigenous and cultural practices, as was described by Stan Rodriguez as well. And so kind of bringing the arc around to, we discussed the evidence both from an indigenous standpoint as well as an academic standpoint. Now bringing the arc around to policy, and really policy on the statewide level. I'm excited to bring to the table Undersecretary Angela Barranco, the Undersecretary of the California Natural Resources Agency, who has worked fervently over the past few years and in her role at the agency, really to increase access and equity. To have conversations with community about what that actually looks like on the ground. And so I'll leave it to her to tell you a little bit more about the Natural Resources Agency's Access Initiative. Angela, take it away.
Thank you so much, Les, and thank you to my fellow panelists and to everyone for joining today. I think it's such an important discussion, and I have to say, I am just blown away by the two presentations that preceded me. As Les said, this just, I think, sets the table for, what I will be my contribution to the conversation, which is what the public sector can really do to implement this incredible need, and really with this understanding, firmly based in the science and culture of what we're trying to accomplish. Because without that, I think these are all nice to have. And what's really wonderful about, these presentations is to show how much they're integral into everything we do. So I'm going to jump in and talk a bit about the policy work. And again, this is all built on this incredible work both in the public health space and the culture space to expand equitable outdoors across the state in a way that's meaningful and connected to all of us. I will start first just by acknowledging, where we're starting. Outdoors, maybe even just 2 years ago, what I would say, we're in this uncomfortable place. Usage numbers were in the decline. And speaking to some of our, outdoor industry partners, folks were looking for ways to engage youth and get them into the outdoors. The conversation was very, very different. And then COVID hit, and all of a sudden, not only, the elements of like recreation and the outdoors were very much front and center, but also the incredible importance for all communities. And so over the last couple of years, we've really been spending a lot of time, as Les said, working with stakeholders from across the state, but also just internally really thinking about what does it mean for us as the state of California to really think about expanding equitable access and being, really a big partner there. And so we are put together an initiative called California Outdoors for All. And I'll just point out that we really think of this as a very holistic enterprise. It's not good enough to just say, you have physical access, and Nasheen sort of so beautifully talked about that. These places have to be connected to their communities, whether through culture and history or literally physically connected, right? You have to be able to have transportation and education and interpretation programs and all that to make these spaces come alive. So our task as a natural resources agency is to really be inclusive of all of these ways to create, additional access. So I'll take a small step back. Actually, I apologize. I forgot to introduce who we are. I mean, for many of you are very familiar with us, but, I think it's also important to ground who's the California Natural Resources Agency, because we are so sprawling. We cover the entire state in the management of all our natural resources. So whether, you've been to our beautiful state parks or, any of our other facilities such as Fish and Wildlife or CAL FIRE, we cover, the the gamut of natural resources, whether it's wildfire, drought, state parks, fish, all the different ways that our state interacts with natural resources. We have 21,000 employees all across the state doing this wonderful work, and we are a major agency that has many entities, and I'll come back to that in just a second. So, really thinking about, the why, and I think the two previous speakers did a beautiful job of making this case, I think, at a larger depth, but just so, you understand the kind of lens we're bringing to it, really just honing in on two specific statistics. And now, again, these are oversimplification, but, really frankly, get to the point for a lot of folks who don't realize, right? We live in this incredibly biodiverse state. It's a place that California is known for its incredible natural resources. But the truth is, access to those resources is incredibly inequitable. And I mentioned COVID and how that really changed people's perception about the outdoors. But the truth is, it also just laid bare for most people who had access and who didn't, right? Like that green line that Nasheen was talking about was so obvious, right? So when all other recreational opportunities shut down, all of a sudden the folks who had parks in their community, had places to recreate, had places to lower their levels of stress, had places where they could continue to improve their physical and mental health. And those who did not had no other options. And so it was a very, very stark. Now, that being said, the statistics are also very challenging. 6 out of 10 Californians live in what is considered park poor neighborhoods. So as Nasheen said, it's not just about having access. So you could have a tiny little park in your neighborhood, but if it's very crowded or doesn't have any programming, it's not really a high quality experience and therefore not really truly access. 1 out of 4 Californians have no access within walking distance, and which is really shocking to most folks. And the truth is, these communities do have higher rates of poor public health indicators, whether it's diabetes, obesity, heart disease, all those things. But even where they're, even where these folks, have opportunities through small parks and everything, if they're too crowded or don't have the programming, like I said, that's also a significant challenge. I will say also, like I said, COVID sort of elevated the outdoors as this, community infrastructure that we all, we knew, especially in our community, but the broader community didn't really fully value and appreciate. But the truth is also, in addition to public health indicators, expanding equitable access is good for a community, whether it's through workforce development, economic growth, climate resilience, right? These are all the elements and facets of this outdoor infrastructure that's so critical to everybody. And so we really, from a state perspective, want to think about how we can use our levers, our resources to be able to expand equitable access for the benefit of all these different community improvements. So what is our initiative? And again, it's a little bit of a sneak preview. We're in the process of going public with this initiative, although I said, we've really been thinking about it for quite some time. It is sort of under the umbrella of Governor Newsom's California for All vision, of course, to expand, opportunity across the state for all. We are very thankful for the personal support of the governor and the first partner. And I believe many of you have, either seen some of the work they've done, just through social media, but also, personally and passionately describing their own transformational experiences in nature. And so, we're just really thankful for their support. Many of you may have been engaged in the 30 by 30 conversation, and equitable access is an important pillar of that work. But we see this initiative as above and beyond, right? While 30 by 30 needs to deliver specific co-benefits to climate and specific co-benefits to access, we really feel like we should have a very focused conversation about all the different ways that we can expand equitable access, and that's what this initiative intends to do. Like I mentioned before, the agency is broad and much bigger than most people realize. And so this initiative is really intended to organize our own health, first and foremost, right? So many folks may be interacting with different pieces. There are conservancies across the state that are doing incredible work in communities that you may all be working with. The state parks obviously have, central to their mission, access to the outdoors. But other folks may not be as aware. California Fish and Wildlife manages 1.1 million acres across the state of public lands. We also have public lands within CAL FIRE and within Department of Water Resources, right? So there's a tremendous opportunity just from a lands management standpoint to organize our 27 departments, commissions, and conservancies, but also really rethink our agency as an opportunity to spur things like a workforce pipeline for the outdoors and other ways that we can really bring and ensure access in the long term. And so, really thinking of this initiative as a comprehensive look at ourselves, then also an opportunity to, really spur a conversation across the state with many, many folks, including all of you, to make sure that we're elevating, the best ideas and challenges across the board. So what are our goals? Like, how are we going to do this? Again, there's such an incredible body of work to show the importance of this, but getting it done is actually really hard. I mean, we do know this because we're all trying to do this in our own communities in our own ways. But to look at the statewide lens, we really focused on three major goals to sort of organize our work. The first being just infrastructure, right? We need to build more parks. We need to build better access within existing parks. We need to partner with others that have extensive public lands, right? So as an example, U.S. Forest Service, federally managed, has over 20 million acres. In comparison, state parks has only 1.4. And so if we're thinking about access across the state, we really need to have a partnership strategy with other land managers. Local parks are about 5 million acres across the state. So again, there's also a local strategy in terms of our discussion there. The second major goal is thinking about outdoor programming. And this one is again, very intuitive for this group here, but not so intuitive for folks who don't work in the space. As we mentioned time and time again, the programming, whether that's transportation to a public space, the educational opportunities, or the interpretive properties to bring the history and culture alive of these places and connect it to those communities, that is all within the bucket of outdoor programming. And that is truly what connects these spaces and makes them actually valuable in all the different ways that we're looking for. This, unfortunately, is the hardest to fund. Many of you have been engaged, and not to get too wonky, but in conversations with previous bonds and previous other ways of funding infrastructure, and oftentimes those funding sources are limited to capital projects. And so, funding outdoor programming becomes a very big priority since it's a critical pathway for expanding access, but also one of the most difficult and challenging to fund. The third major goal is my favorite, which is thinking about the sort of systemic change question. How do we really think about our state government and all of our entities? Like I said, we have major land resources, we have major people resources, and we also intersect with much of the community that's trying to do this work, whether it's to be through permits or grant making. We do a lot of things in this space. How do we make and improve our systems to be able to be better partners, but also to accelerate, prioritize, and focus our investments in ways that will actually have greater impact, right? And that's the way that, we can leverage all of these resources to benefit. So I mentioned something as simple as permits. Folks have had a lot of trouble doing something as simple as getting a permit to bring, kids to a beach, right? And that is something I think this initiative seeks to sort of elevate, where the challenges, the low-hanging fruit, essentially, of where we could potentially make it a little bit easier, a little bit faster to be able to do these things, so folks can, make that access possible. I would say, it runs also the spectrum into what I would call these like big, thorny, crazy, big sky ideas. How do we use our 21,000 person agency to be a pipeline for diversification of our outdoor equity and natural resources, employment, right? We ourselves can become a pipeline rather than waiting for a pipeline for us. And so how do we think about that as well? Because that's really integral to the future of, expanding outdoor access equitably. And so, and then, another example I'll mention is multi-benefit infrastructure. Many people, and I love this phrase, it's kind of wonky, but, when you think about building something simple like a metro line in LA, let's say, it's a great example. You're building infrastructure that really connects different communities, right? Why can't there be green space associated with that, or other types of outdoor, accessibility that comes with that? You're going to be building bridges, you're going to be building right-of-ways. Let's think in the different ways that we can expand these resources to develop multiple benefits. The same with housing, the same with workforce development. All of these funds should be working together. Now, that's super challenging for many of you who do grant making or intersect with the grants world. That's not an easy proposition. And so what can we do from a state perspective to really improve that work? I can go much more into detail on all this, but I will tell you, we will talk much more about this and invite you to a further conversation. But, we've really started to think about all the pieces, whether it's priorities or some near-term work. So I'll just spend the next couple minutes talking about 3 major near-term pieces that we just really want to highlight as kind of like what we're working on right now, and then ways that you guys can get involved. So the first near-term piece is the budget. I mean, one of the state's major levers is the funding that they bring to the table, right? And it's all of our tax dollars at work. And in the 2021 budget, which was enacted this summer, we got $1 billion worth of access-related work. This is historic and unprecedented. And yay, so a lot of that is due to your wonderful advocacy, to the commitment of our legislators, but also to the focus, right, that we were able to bring by creating this initiative and creating this sort of lens under which we were trying to have a conversation. About $500 million was for local grants. So whether that's, building parks and communities or funding these programmatic, partnerships for transportation, for education, for interpretation, really historic across the board. None of these grant programs have had this infusion of dollars before, but it is one-time funding. And so what I will say, I really think of this as a down payment. When you look at just that first line item, the statewide park development and community revitalization program, there was over $2 billion worth of requests for that fund. And so $180 million is gone already. And we have a lot more work to do. But again, the fact that we got this and we were able to get it out to communities right away is a huge benefit for everybody. And it just makes the case for why we need to do more. I will also mention that, for folks who are really focused on our state parks and other state facilities, there was $500 million for improvements there. Even an organization like State Parks, whose entire mission is about access to the outdoors, there's a lot of work we need to do. Just physical access is expensive. The maintenance of that takes a lot of work. And so an investment there of that scale is really pretty impactful and epic. So the second near-term piece I'll talk about, just sort of in passing, is, by having this opportunity to demonstrate our leadership in the space, California has an opportunity to lead, not just, in our own little world, but also with the federal government and with local governments as well. And so we really intend to use this momentum that we've created by $1 billion in our own budget to come, bring others to the table to have a conversation about how we double, triple, quadruple our impact, whether it's by matching funds at the federal level or working in partnership with our local, parks interests who, have already spent significant bond dollars and, at the local level to be able to construct their parks. And really by using this momentum to just have a conversation about how we can prioritize, it makes all the difference, right? So if you can sit down and say, here's all the ways, we want to really do this, and you can align policies, you can align funding priorities, you suddenly can really increase your impact tremendously. I'll also note that, our government-to-government consultation with tribal nations is really critical to this conversation as well. And thinking about access priorities and co-management policies that we can work together on with our tribal nations. And that is a really critical component of this as well. The last piece I'll really flag, and I think I mentioned a bunch of intersectional ways that, we can think of our work in this space, but we really should be actually working with those sectors as well. And so that increasing our table to include folks from across the public sector that are thinking about public health, education, workforce training, transportation, economic development is really critical to this initiative. So, we're going to be expanding partnerships within our state family. We've already launched a very extensive conversation with public health colleagues, but the truth is there is opportunity across the board to expand that conversation as well. And lastly, and this is my last slide, this is the ask to all of you and actually opportunity to join the conversation. We will be launching our statewide listening tour in mid-December, really to engage a number of sectors and a number of regions in this conversation, and we would love for all of you to participate. This is an opportunity to join a conversation very similar to ones and build off of the conversations during 30 by 30, but like I said, at a broader lens, looking across the state and across all the ways that we can expand equitable access, with our hope that we would culminate, sometime in 2022 with a long-term roadmap, essentially a strategic document for the state, as we think about the many ways that we could do a short, medium, and long-term, approach to expanding equitable access and what our role as a state will be moving forward. So just really appreciative of all of your time and just look forward to continuing the conversation. Like I said, this is just the start of what we hope is an acceleration of the work due to all the incredible work that you guys have done to bring us to here. So thank you again.
Thank you so much, Angela, and thank you for really charting that path forward for the state, and also just for leaning into conversations like these. I'm interested in learning a little bit more, especially about that partnership with Department of Public Health, and what are some of the ways that CNRA is looking to partner there. So we'll bring that into the panel discussion. But last but certainly not least, I'm excited to bring on our last speaker before the panel, and then Lexus will be joining us for the panel. But our last speaker before the panel is Ale Ricardez. Ale is not only a colleague, but has also become a friend, and is also a dear friend of Outdoor Outreach as one of our board members as well, and has brought an incredible perspective, not only from the health sector, but also an incredible perspective around community planning, city planning, as well as social justice in our community. And we've been really excited about the ways that Blue Shield of California here locally has really leaned in on the conversations around community resilience, and how do we promote community resilience and well-being upstream. Which, as someone with a background in public health, we're always talking about how do we move further upstream, and so we will we'll add her bio also to the chat box for your review. But without further ado, I'd like to bring Ale Ricardez on. Thank you, Ale.
You are very welcome. Bienvenidos. Muchísimas gracias, Les. It is an honor. I'm just humbled and honored to have been invited to present and join this wonderful group of thinkers and doers. It's my pleasure. Muchísimas gracias. And bear with me. Okay, so this morning I will be speaking to the best of my ability how we at Blue Shield of California are thinking about prescribing nature as medicine. I will be talking about some of the pilots as models that we are looking at very closely, including the work that Les is doing with Outdoor Outreach and Rady Children's Hospital, which is one of our providers. I will also be addressing some of the implications to scale some of these pilots and models that are working in our communities, and share from my heart some of my ideas as to how we can move forward. These are the 5 specific topics that I will be sharing with you this morning. Who we are, who Blue Shield of California is, the best lines of business, the populations we serve. I will be talking about participatory community resiliency, to your point, Les, the work that we are doing with closely 30 community-based organizations in San Diego where we're piloting what this really truly means, centering the work that we do around the voices and experiences, lived experiences of the communities that we serve, and the power of pilots to scale these efforts within our organization, and also that have implications to the ecosystem at the larger level for healthcare. And we'll share what I think it is that we can do moving forward as a community. Who we are, Blue Shield of California is one of the health plans locally in San Diego that manages and provides benefits under the Medi-Cal program, or known nationally as Medicaid. And I have the privilege of working with a wonderful team of clinicians, social workers, and other members of my team to bring services to our communities with a members first philosophy. As a nonprofit health plan, we are accountable not to shareholders, but rather to the people that we work with, to our communities. Wanted to share too about our health equity framework, how it is that as an organization, as a plan, we are moving from theory to action. It is absolutely not new to our understanding of health that there is inequity. As an urban planner myself, and currently as a student in an MHA program, the connections between zip codes and health outcomes is not new. However, what we know is that there is an urgency to address these inequities as yesterday. We are much aware as an organization that provides health benefits to our communities that racism has emerged as a public health crisis. We also are much aware that these issues, these disparities that my colleagues have pointed out, that are much real when you look at just one zip code from another, they are rooted in structural systemic racism that is very much has a timeline when it comes to policy decisions. Redlining as an urban planner comes to me really as one of the policies that roots the disparities that we see in our communities. We are also committed from our leadership to achieve success, move the needle, so to speak, and that we are going to get to this success standing together to advance in sustainable and meaningful ways what health equity means, not just for us as an organization, but just as importantly to the communities that we serve. And we are committed to address health as a social justice issue, which is what has been happening in other spaces. And that is a commitment that's coming directly from leadership. As a member of the community engagement team, I hear this consistently, that there is this commitment to work together to address the many health equity gaps. Just briefly wanted to share the work that my team does. This is an amazing, wonderful groups of committed, passionate professionals. These are the 4 goals that guide the work that we do in our community engagement team. We look to strengthen community footprints through what we call trust-based and participatory-based engagement and investment. So together, just my colleague Patricia and I manage roughly 300 community-based organizations, or relationships with at least 300 community-based organizations in San Diego. We are privileged to have developed trust and really look at their work that they're doing to guide how we're showing up, the programs that we are supporting through our investment. We're also a plan that looks at innovation as a way to bring meaningful interventions to our communities that are focused on reducing the many health disparities that we see in our populations. And also we, as a plan, are committed to enhance what Medi-Cal is. As a public policy program, it's a federal program. Medi-Cal offers 10 essential benefits to anybody that enrolls through different doors. As a plan, however, and through the way we show up in the community, we want to enhance and leverage those 10 essential benefits that members have access to. We do so through it's investments in the community, and I will be talking a little more about a couple of the pilot programs that are helping us find better ways to invest and leverage the enhancements that Medi-Cal offers to our members. We also serve as a convener to bring resources to the community in as meaningful of a way as we can possibly, as an organization and as a statewide plan. These are the three areas that for 2021 have guided our trust-based investment and participatory planning: health equity, mental health, and social determinants of health. The slide just gives you an idea of where we're focused in terms of the trust-based investments that we are doing. I will not go into any detail. I think the slides, you're going to be sending the slides to program participants so that they can look a little closer to how we are showing up and what the programs are that we are investing and supporting. I wanted to spend a little more time, however, on community resiliency and the work that Blue Shield is doing in this space. We launched what is now the Community Resiliency Work Group, and Outdoor Outreach has been true partners from the very beginning to focus on ideating, on creating together interventions to address childhood mental health and resiliency in a participatory way. And that for us has been an interesting process and an interesting challenge, because as an organization and as a system, as an ecosystem, we're very much focused on rapid improvement and moving the needle as fast as we can. So the work that the Community Resiliency Work Group has done has helped us to understand how healing happens also as a process, not just as a result. To date, we have more than 30 community-based organizations that have helped us to drive the way in which Blue Shield of California is developing these interventions that we hope will address wellness from a holistic perspective. And we are together creating intervention pilots that have very much the voices of the community at the center of what we are developing. Quickly enough, as we developed the Community Resiliency Work Group, we heard the first call loudly and clearly from those community-based organizations. The first ask was for us to center the lived experiences and the voices of the people that we serve at the center of the interventions that we created. And because the Community Resiliency Work Group focuses on resiliency and wellness and mental health for youth, the ask was, well, go and ask youth what this means for them. Is there a different way that they can see resiliency? What are they doing? What are their ways? What is their language? So we conducted the first project that I led and that we implemented through the Community Resiliency Work Group was a conversation with 200 youth, the most diverse group of youth in terms of age, gender, ethnicity. and with the support of community-based organizations, because the community-based organizations were the ones that conducted these conversations. It wasn't Blue Shield, it wasn't our institution or our organization, rather, it was the community-based organizations that have the trust and the heart and mind of our members. And this is the infographic that presents the results. And these, the qualitative data that we gather is informing the interventions that we are about to launch. I will later drop the location of the infographic for those of you that are interested. It's been published. It lives in our landing page together with larger initiative that we are running as part of Blue Shield, our parent organization, called Blue Sky. Blue Sky provides access to behavioral health through schools, and that's another initiative that we're committed to. As an organization, we believe in the power of pilots, very much so. We believe in the power of pilots in providing and driving results. We believe wholeheartedly in the power of pilots to drive strategically interventions that drive equity in a holistic, but also in a culturally and linguistically meaningful way, and how pilots help us to center the experiences of the populations that we serve. Pilots are also very powerful in terms of providing us quantitative and qualitative data. I'm looking very closely at the work that you are doing as member of the board, but also in my role with Blue Shield of California, the pilot that you run in collaboration with Rady's children. It's a magnificent example of how nature was utilized as a prescription. It was run scientifically. It meets all of the requirements for us to look at the implications that it brought in terms of its effectiveness to increase resiliency in youth, to decrease the mental health issues that you were seeing in that specific group. And I think also it added incredible value in terms of providing youth with leadership opportunities for building the next generation of leaders that will be understanding policy and bringing equity as a goal, and drive the ways in which we can change systems. I'm also looking at the work that I have done in my own career. My first gig as a graduate student was working with one of our clinics now, True Care, formerly known in San Diego as North County Health Services. As a recent graduate, I was given the amazing opportunity to develop mental health intervention for farm workers. So that has tremendous implications for what we call population health. There were concerns and issues within this population. The clinic had a mobile clinic that provided services. And to no surprise to those of us that know the community, there were high incidents of alcoholism and other issues in the community in this particular population. So we received funding from the California Endowment to develop a plan. And so that was my responsibility to create a linguistically appropriate model that we incorporated in the continuum of care. So at the end of the day, we developed an advisory board, and we also translated a basic depression scale from English to Spanish. And then I worked with one of the key folks that was serving the farm worker community back then, which was the lonchero, or the trusted messenger in that community. And we translated the depression scale into Mixteco. I didn't stay with the clinic, so I'm not aware of the implications of the result, but those are the models that I'm looking at very closely in terms of looking at holistic approaches and non-clinical interventions to address mental health issues and other issues such as diabetes that are presented in our populations that we serve. Broader implications for these wonderful pilots that have had results. One of them as a system is one of scaling, right? All of this amazing research that Dr. Nooshin and others are producing absolutely creates a link between the interventions and the impact it has in terms of not just physical, but also mental health. As a plan, however, the task for us is to use these best practices and scale them within this larger ecosystem of the, of us as a health plan, providing benefits through a federally designed program that has very standardized benefits. Anybody that enrolls in Medi-Cal has access to 10 essential benefits that includes behavioral health, primary care, hospitalization, maternal care. But it's prescriptive in that it has those 10 essential benefits. So scaling is one of the challenges and the implications. How do we scale these pilots that you are running to impact population health? That's a challenge because we're working within an established system. Another implication is payment models, right? So how do we look at the power of the work that you are doing and other organizations are doing that are creating these pathways to look at prescribing outdoors as a medical intervention and incorporate them into this very complex payment system that Medi-Cal has, whether it is within the public health system, which is Medi-Cal, or in the private system. Blue Shield is an independent entity, but we are an organization that belongs to the larger Blue Shield of California, which is the entity that manages our commercial lines of business, Medicare and other lines of business. But finding payment models, that's a big implication, that's a big challenge that we have. However, I'm incredibly hopeful because I have wonderful colleagues that are looking at the implications of pilots, for instance, looking at medically tailored meals and including those interventions as part of the benefits directly. So they're incorporated as a benefit into Medi-Cal. And we will be closely looking at that. There are entire teams that are working, bringing their expertise in what we call our Health Reimagined team within Blue Shield that are looking at all of these from a holistic perspective in terms of systems change, in terms of creating better and more efficient payment methods, but also in reimagining what access means, right? And who is doing these upstream interventions, not only the fact that we do need to go upstream, but who is driving, right? Who is going up to the river and who is getting those people, the folks out of the river, right? Is it us, or should it be the community themselves that are providing these ideas? One of the interventions that I'm driving, I as a subject matter expertise, is happening right now. To no surprise, we are seeing the implications of inequities in the way COVID-19 is impacting our communities. There are zip codes where there are remarkable differences in terms of rates of infection and death. And so We received significant funding from the state, approximately $350 million across the state, not us solely as a plan, but we are uniquely looking at the work that San Diego Wellness Collaborative, which is an amazing model that's looking at developing a community-based organization network. As much as we have an IPA networks of clinical providers, this is an interesting model that looks at community-based organizations as a network that Blue Shield of California Promise can tap into and can leverage to incorporate this community-based interventions. And it's a really promising model, and I'm very excited. We brought incredibly, we worked incredibly hard, but we're also honored that we will be deploying in San Diego alone as a plan, the power of 22 promotoras, community health workers, to do this work. They are the trusted messengers. They know what works with the community. They know the language. They are the most efficient folks that can do this work for us. Another implication is it's evaluation. I'm not an epidemiologist, but for us as a system is one of scaling, but also establishing correlations between interventions that result at a larger systemic level. That's an implication, and that's also a promise. So I'm excited with the connections that are being created today, because will be looking at the work that Dr. Nasheen is doing and bringing that research to desks, the virtual desk of my leaders. We're also much aware, and I am very much aware that perhaps some of the work, some of the solutions that we create as a system are much disconnected from the lived experiences of the members that we serve. And so that's an implication, that's a challenge, but also that's a huge opportunity for us as a health plan to make sure that the solutions that we come up with as a plan in Blue Shield of California and Blue Shield of California Promise, that we make the true connections between how we're reimagining healthcare and whether these solutions that we bring make sense to the members that we serve. Quickly, I am not an expert on Call-AIM, but it is one of the biggest policy changes that we've seen to Medi-Cal as a system. For us as a plan, it means that we will be better able to provide care to our members at the right time, the right place, in a culturally meaningful way. It's bringing policy changes to how we process payments, and it will make it easier. It will decrease barriers to our members in terms of accessing care. As it is, we're one of the plans that gets really great reviews in how we provide two services: transportation and interpreting services for our members. But Call-AIM has tremendous implications in terms of how it is really, from my perspective, forcing us in this system to imagine wiser ways in which we can provide healthcare to the communities that we serve. So I can drop a link for folks that are interested in reading the 400-page policy that explains what Call-AIM is and the implications that it will bring to the system and how the system provides care to our communities.
Totally. And Ale, I don't want to steal your thunder, especially as you're going to speak about moving forward. Would love to bring this also into the panel discussion as well. So wanted to transition us and just say thank you so much for this presentation, especially looking at how we can better integrate nature into various payment models. So I want to bring that up as a question also in the panel discussion. Thank you all again for your amazing presentations. I wanted to bring also Lexus into the room, into the panel. There she is. All right, Michelle, if we could bring her on screen as well. Thank you to each of you for presenting. And Lexus, welcome onto the panel. You're no stranger to many of the folks on this call, as well as not a stranger to this webinar as you helped us kick off the first session. So I wanted to, in kind of kicking off this panel, just to really ground us. And we talked about it from an Indigenous perspective. We talked about it from an academic perspective. We talked about it from a policy perspective, from a healthcare systems, insurers, community benefits perspective. But really, in so many ways, you've lived directly the healing effects of being in nature. And so wanted to ask, to the degree that you're comfortable, if you could share with us a little bit about what that experience has been like and what it's been like also in your journey with outdoor outreach and bringing those same healing experiences to others.
No problem, Les. Thank you for letting me speak on this panel. I've heard everything today. I didn't leave. So it's been amazing to hear all the work that's been done and to see all the different sides of things. So a little bit about myself is that I grew up in foster care until I was about 10 years old, from about 1 to about 10, after my siblings fell out a 2-story window because there was no one to supervise us. After that, I only spent most of my time with my sister, and I didn't have any relationships with anybody else in my family other than her. And when I was 10 years old, I was sent back to live with my mother, who I didn't really know, and things weren't any better there. It was a very kind of depressing home. There was a lot of drugs involved, a lot of mental health issues, addiction, things of that nature. And so I spent most of my time by myself, reading books and focusing on my education because I knew that was the only way that I was going to get out of the situation that I was in. But by the time I entered high school, I was a pretty closed off individual. I didn't talk to anyone. I barely had friends. I didn't speak to anybody, and I didn't try and open myself up to relationships or anything like that. I went to school and I went home and I stayed in my room. And then my English teacher asked me to join this club at the school. They had low members and she thought it would be a good thing for me. And my first reaction was no. Going to a club meant interacting with people, and that's not something I wanted to do. And so she bribed me with extra credit in her class. And, I was like, all for it. Okay, sure. I'll just go one time and see what this is about. I probably won't stay, but, we can try it. And I went, and it's honestly the best decision I had ever made. It was outdoor outreach. They called it Adventure Club. And my first thought was like, why is this white man talking to me about taking me to surfing? Black people don't surf. I hadn't been to the beach in like 10 years. And so it was honestly like stepping into the Twilight Zone. But it meant that I didn't have to go home, and that was okay with me. And so I went on every trip. It first started just not wanting to go home, and it evolved to, wow, these people want to listen to me and they care about what I have to say. And wow, these places that I'm going to are gorgeous, and I never even knew that they existed. I've lived in San Diego my whole life, and I had not been to the beach in 10 years. I had never seen Dixon Lake. I didn't go outside of San Diego. Honestly, I didn't go outside a 1-mile radius of my house. If I couldn't get there by the bus by myself, I didn't go. And if it was like more than 30 minutes away, I definitely didn't go. So it was honestly just an eye-opening experience about what was around me and just how impactful those places could be for me. It was honestly just the best feeling of going outside and rock climbing and going outside and going camping. Just like sitting down and being able to take a breath and not have to listen to, you know, my parents yelling or the ambulance or police sirens. It was just amazing to just sit there and figure out that this is what silence felt like, and figure out this is what peace felt like, and that it was there and it was mine for the taking. And I grabbed it with both hands and I didn't want to let it go. And so I ended up graduating from high school, went off to college in Grand Canyon University in Phoenix. And then I came back and was all psyched to let me back into outdoor outreach so I could do the same for others. Kind of told them where they could put me, where did they want to put me, because I definitely wanted to be able to give this to someone else. And so I started as an intern working directly with Rady Children's Hospital. So I helped kick that off, working with mental health and kids with medical issues like heart transplants, diabetes, fibromyalgia, etc. And working with them to show them that, you know, their past, their labels, anything like that, that didn't define them. And it definitely didn't hinder them from doing anything that they wanted to do. It might take them a little longer, but that was it. But they could do it. And I got so many stories from these kids talking about how they had always been defined by their mental illness, or always been defined by what they couldn't do because they had this transplant or that transplant. They had this disorder or that disorder. And then coming here felt like they could do anything that they wanted to do, and like nothing could stop them. And that's the feeling that I felt when I was with Outdoor Outreach. So it was honestly like a cycle, a humbling experience to be able to give that back to the youth that I was with. I stayed in that position and then got promoted to a YPAC, which is a youth programs assistant coordinator, where I worked with JCCS, which is the juvenile court system, and worked with NCRC, which is a local organization in San Diego that works with kids coming out of the system or in the process of the system. And so it was just another type of kids that I, you know, had seen in my youth, and got to tell them that they could do and be anything that they wanted to do and wanted to be. And to teach them that there was healing in the outdoors, that there was a place for them, that, you know, it didn't matter if no one out there looked like them. That was okay, because they could be the first one, and they could show other people that, you know, we can be here, and that this is our space, and this is our home, and this is our place of healing too. And so I did that for 2 years, and now I'm in the development coordinator position, which I work with donors and I work with the finances. And so I try and get as much money in as possible so that I can keep these kids going out on trips. So that's a little bit about me and about my story in the outdoors and just how healing it is. So I'll pass it back to Les.
Thanks so much for that, Lexus. And Alexis, you're humble also, and I made sure to embarrass you a little bit and share the link of the powerful film that you were a part of last year. And there's one scene in particular in the film that I think best defines or kind of summarizes Alexis's impact really in our community. And it was this one moment where she's holding on to a kid as they're learning to ride a bike for the first time. And she says, you know, don't worry, I got you, I won't let you go. And it just combined the transformative power of the outdoors, but also to what Dr. Nasheen Razani had also shared earlier, of just the power of social connection in those spaces, and in really paying that resilience forward in a powerful way. So Alexis, if we have a little bit more time on this call, I'm gonna circle back to you and ask you about kind of, you know, trauma-informed programming for those that are outdoor providers on the call. Just sharing maybe like, what are the fundamental tenets of trauma-informed resilience building programming? So I won't put you on the spot yet. I'll come back to you on that one. But I wanted to come over to Dr. Stan Rodriguez. Stan, kind of reflecting on what you've heard throughout this conversation, you grounded us first in the creation story and the indigenous knowledge of nature's healer. and how we are a part of and not just connected from. And that has also been a recurrent theme throughout this series. What are some of your reflections on what you've heard from the other speakers in terms of the policy and public health implications of outdoor engagement?
Well, first of all, I just wanted to thank all of you for sharing, bringing your expertise into this. Really touched my heart. And, you know, a lot of things you're talking about when you talk about policies and, you know, when we talk about policies, it's being an advocate in order for us to have these, and I'm talking about our spirituality, I'm talking about our native beliefs, and it sounds like we have much more in common than we do not. And, you know, this earth, being out here, it's healing for all of us. And, you know, developing these things just really, I mean, it touches my heart how we can all come together like different facets of a diamond and work together in order to make this happen. And I just want to pick on Lexi real quick. You know, I'm going to hammer on you right now. Thank you for sharing that. I just wanted to share when we take our tribal youth out, like when we did the Thule boat run, we made 22 Thule boats out into Mission Bay, Crown Point. That's the first time in over 100 years that many Thule boats has been out there, and seeing not just, you know, the youth, but their parents, grandparents out there, friends coming and just taking part of that. I mean, it just brought people together, and, you know, it was a point of healing. When we take our people out into the desert, teach them how to roast agave, things that haven't been done in over 75 years, and teaching that back to our people, and watching others start to carry on what we do, and having all these things done. It's not only empowering, but it also develops a sense of self-efficacy. If I can do these things, I can do many different things. Self-care is so important out there, and to be able to ground oneself. And, you know, I mean, just listening to you and everything that you've gone through, the resiliency that you have, I mean, I take off my hat to you. Just wanted to share that with you, Lexi, and with all of you. It sounds to me like we're coming from a group of people who just really care. And I just want to share that. And as I just want to say to all of you, Chachaya Khan. And in my language, what Chachaya Khan means is I praise all of you for everything you do. Thank you.
Thank you so much for that, Stan. And yeah, just to echo, as you mentioned, the Thule Reed boat launch, and just kind of in a sharing and full transparency, that weekend, I didn't share this with you, but that weekend for me, full disclosure, I have general anxiety, and that weekend was a weekend that triggered a lot of anxiety for me personally. But there was something about coming out to that Thule Reed boat launch. I don't know what I had expected to experience that day, but truly, as you were saying, talking with a group and mentioned nature as medicine, it all came together, that sense of community, being out on the water in that space. And so it was a recent personal lived experience as nature as healer.
Yeah.
I wanted to pose this question maybe to Ale, to Angela, and to Nasheen, around kind of the next steps moving forward. So, you know, looking at the leaders for outdoor equity, and we have both our cohort as well as the broader community across the country kind of chiming in today. What are some of the ways in which land managers in particular, as well as environmental organizations, outdoor recreation groups, what are some of the ways from your experience that we could move this work forward, making the outdoors more relevant as a healer, and just kind of looking at some practical steps? So Ale had alluded to kind of the concept of payment models, and how we're considering how we're considering our current payment models, our current healthcare system part of what intrigued me in this work was my mentor in San Bernardino County had piloted a program where he was actually making outdoor programming Medi-Cal billable, integrating that with the clinical approach to bring about healing. What are some other examples, some tangible examples that our audience can really take away in that space?
The way I was going to end is by just bringing some aspirations that I have as an self-identified indigenous person. I was born in Oaxaca. I grew up in a very small village where we have usos y costumbres and practices that have definitely provided the framework for how I think of resiliency. I think as a system, we need to listen deeper, and become literate, not only in the languages of the communities that we serve, but in the way that we as indigenous communities conceive of health and relation to nature. We need to shift our models from result-only models, from running after the numbers. We need to look at how wisdom is deeper than knowledge, really. And that it is our communities that are the touch points to this wisdom, to connection to nature in a bigger way. We need to also look at circles rather than hierarchies of knowledge and hierarchies of power. Those are, I think, the ways in which we as a community, as a system, can continue working together to have greater impact in terms of equity and healthcare. Those are sort of my last sharing thoughts. And in any work that I do, I honor the work of my parents, farm workers that left their sweat and tears in this land. And so those are my parting thoughts. And I'm sorry, I do have to drop. I have a very important call at 11. Thank you so much to all of you. I'm incredibly honored to have shared this virtual circle with everybody. Thank you, Les.
Thank you so much, Ale.
I can jump in, Nasheen, just to talk a little bit, about the very practical world of government and politics. I think, as Ali also sort of hinted at, just elevating these stories and these opportunities that you're all actively working on. So, we are all doing what we can in community and put our head down and get that work done. But the truth is, every single day we're learning different ways that things are working or not working. And the state really benefits from understanding the complexities of the application of our work at the at all levels, right? At the local level, understanding, I know Lexus mentioned, getting folks to give money and grant processes and all the complexities of just running an organization. We really want to hear about that because we need to understand better how to make that process faster, easier, stronger, bring you more money, right? Whether it's the folks who are building projects and, dealing with permitting and infrastructure and all those complexities, or, creating programs, we also need to understand, where are the places where getting a permit was really hard, or just simply bringing together different streams of funding to be able to build your park was a challenge, right? And I think those are challenges I would point out, but there's also great opportunities. You guys are figuring out the best way to bring people to these spaces to, frankly, to, expand people's minds and include the outdoors as part of that conversation, right? And we need those blue sky ideas as well as part of this process that we're doing for the Outdoors for All initiative. So I would say, just help us by just coming to the table with all of those ideas. And I know many of you participate in different processes, and our hope is that this will bring together all those different sets of knowledge into a way that's really actionable, at least from the state perspective, and really move the ball forward on all those different pieces. So more to come in terms of an invitation to join us, but please do see us as a resource in many, many different ways.
And then Nasheen, just to tailor your question maybe a bit, we had a great conversation in the planning call leading up to this conversation. And some of your work is also around, some of your work around ACEs Aware, as well as otherwise is helping to inform collaborations between government agencies there as well. Could you share with us a little bit about some of your vision kind of coming out of that project as well?
I mean, I think the real need in the healthcare world is really to span the different language between healthcare and the outdoors. And so within healthcare, what I've tried to do is really piggyback on the already established and funded efforts, which really dealing with social determinants of health, and right now ACEs, which is early childhood trauma, are things that have already been funded and have more credibility than this new and nascent field of outdoors. And so, for example, for the first time ever, all Medi-Cal providers will be reimbursed for talking to families about ACEs. And so what I did was to apply for a grant that was about ACEs, but to really pitch the outdoors as meeting that already established intervention need. And so I think the partnerships are really important, because then people in the outdoors can know that, oh, well, this is something that's already has a lot of political will around it, and how do we position the outdoors to meet this need. My other, on the other hand, when I've been working with outdoor agencies and their funding requirements, my ask and my plea is to start using some human-based outcomes in how you evaluate your own work. As an example, like during COVID, I would sometimes talk to people in the outdoors world who wanted to really use the power of clinicians and our relationships with patients to, what they would ask me is like, we want more diversity in the parks, or, we want X, Y, and Z. But at that moment, what they needed to say is, how can we show up? Like, there is a crisis, a human crisis right now. How can we be of service? Like, how would it help our community and clinicians to have access to us? And so I think if outdoor agencies can learn to speak in a way, because they really do have that desire to show up for community, but instead of trying to partner with clinicians to fulfill just like more bodies in the park or in their programming, to really try to understand, like, how can we show up in your mission of human health? That really helps. And one thing that is very hard for me, which is an area of growth in the outdoors world, is really the lack of people of color in leadership positions. And so there's so many people we want to partner with. We want our patients to go surfing, but like, when you hear from Ale and Angela about what it really takes to impact community health, it needs to be centered in the lived experiences of the people. We are evaluated on whether people get better or not. And so some of that is possible in a cross-cultural context, but it's much easier if the outdoors world actually can include more people from community. It will be easier for us to partner.
Absolutely, absolutely. And what a better way to end this conversation, being mindful of time as we're at the top of the hour. Thank you all for your contributions. I have so many other questions. I would love to dive deeper in just so many directions, as this is a personal passion, this topic in particular. So thank you again to our phenomenal panel. We'll be looking forward to sharing out the presentations as well. So you'll have access to that. And just in terms of some housekeeping as we close, so just wanted to give a reminder to everyone here, our final session of the Leaders for Outdoor Equity training series will be on December 16th. For the leadership program cohort that is on the line, the session will also be available in person. We'll be gathering in person at the Urban Wildlife Refuge, hosted by U.S. Fish and Wildlife Service. And I'm also excited, and we'll find a mechanism of sharing this out on the website as well. Our Leaders for Outdoor Equity cohort is also working on some transformative capstone projects that will really shape their communities in really powerful ways, from more inclusive signage at the Living Coast Discovery Center is a project that's being worked on, to public engagement plans that the County of San Diego's Department of Park and Rec is really working to develop, to focusing on San Diego County's diverse integrated park system, to installing multilingual signs in the City Heights region, one of the most diverse communities in all of California. So super excited to highlight just a few of the many capstone projects that are also happening concurrently with these webinar series, and the ways that leaders in this group are taking action and taking advantage of the information that's coming out of these webinars. So thank you all to the cohort members. Thank you all to those of you that have been joining monthly with us, and we look forward to seeing you again next month. Thank you.